Thank you so much for staying with us on Souq podcast. Like we promised, that we're going to be bringing to you some of the participants on today's training. Yes, the training is going to be a week long, but it started today, and so far it's been a very interesting one. I could see the participants in there laugh and also respond. It's been very interactive and quite engaging as well. So we have with us here, right here, Dr. Irene Akidino, who is a medical practitioner, and she is with the Area Specialist Teaching Hospital in Edo State. She's traveled all the way from Edo State to be part of this training. If you know Area Specialist Teaching Hospital, you must be conversant with some of the strides, medical strides that they've made. During the COVID-19 era, they were there and they actually were able to help. As you know, that the medical sector did actually perform well in helping to contain the spread of COVID-19 pandemic. Not only that, when you hear Lassa fever, so one institute that is like the go-to in terms of treatment containing the spread, then you should think Area Specialist Teaching Hospital. So she's here and she'll be talking to us about the change narrative in Nigeria. People say we have lots of policies, but what have we gotten from the policies? First of all, you traveled all the way to be part of this training. How has it been for you, day one?
Well, thank you very much. I have no regrets. It's been quite engaging, enlightening, and I think the interactive aspect has really been good. So far the facilitators have been amazing. And the fact that we are from different sectors brings to bear, your different experiences. The problems may be the same, but I think with the facilitators, the solution is almost the same, despite what institution, either public or private, you come across, and not just dwelling on the problems, but thinking of the solutions. So that's, I think, the strategic insights which the course is all about.
All right, so now this is Lagos, but apart from it being Lagos, this training has afforded you to meet with your colleagues, counterparts in other fields, and like you said, the conversation is revolving around the same thing. What can be done better for these organizations to stay relevant and be able to deliver value to the consumers? Now, the theme is strategic insight and planning. Now, if we look at government agencies, how does this apply into this world, knowing that the global thinking is changing? So around different sectors, there's a paradigm shift. How is Nigeria playing to ensure that it's not left out?
Yeah, thank you. We talked today about things like looking at competition in a positive way. And looking more towards collaboration and partnerships than competitiveness. The way it is even globally, you can't necessarily have all the resources, but you can partner with public, private sectors. The federal can partner with the state. I was telling someone, I said, yes, initially we used to be the only one, when it came to top Lassa fever, but we're a country of over 200 million. There is no way we can, cater for everybody. So the important thing is, how do you grow other people in other regions? So places like FMC or are also growing in this. We dialyze patients that have Lassa. The hospital will be, and we've had 0 to low mortality of staff from Lassa fever. So when other people come, we have a fellowship now. People can come and do a fellowship and look at all aspects. I'm an intensivist. So we ventilate and we have a critical care unit for them. But the main thing is collaborations, your strengths. What are the strengths each person has? Because really, that is the only way to grow. Okay. You realize that there's a deficit. How do we meet up? You collaborate with private sector. I think Blue, Lawsuit, and Triton are doing that for cardiac, and they're able to achieve more and train personnel. So I think that's a big one, and really attitudinal change is key.
Okay, so let's talk about policy. Different policies are made to fit specific sectors and purposes. So would you say your sector, you find it very easy adapting to the policy meant for your sector? are there challenges? How are you trying to, make this work? I mean, I see you smiling. It's a challenge, but because we mentioned that earlier that we have good policies, but the issue is making sure that you see them to the later. People get to do this thing. So, in your own sector, how would you say this works?
Well, if we have to be sincere, really, these policies, everybody knows we make very fantastic policies, but how do they get to fruition? And I think that is where this comes into play. These are the policies, There will be a lot of challenges. We understand how the landscape is, You have a policy on availability of healthcare, the number of doctors, but in reality, a lot have left. But you need to still be able to render care because policy you are this center for that,
Okay.
But the main thing is, in the same thing, you have these issues and these challenges. How do you improve your strengths and make them become competencies? How do you become creative? I was telling them, I said, because we had experience with LASA so much, and we're always running out of PPEs, we decided to produce our own PPEs that we could wash, we could autoclave. So when COVID came, we already were used to something. When you prepare before the need arises, you go through all the downs, and we're able to do that. Now we have, whenever at the end of a NASA week, we still have our regular meetings and updates. And how we look, reflect, where did we go wrong? How do we improve? So the thing with policies that they can be there, but when you put them on ground, you have to continue to evaluate yourself, and improve and be creative. We have to be creative. That's
true.
That's the only way.
Okay, so let me also ask you this. I think in the course of the training, Dr. Ken mentioned attitude. So I'm bringing it to your sector. I remember he was talking, he even referred to an incident, talking about the attitude of a nurse towards someone and all of that. So as a leader in that field, how well would you say you've been able to change this narrative?
Well, in sincerity, I think even if you have all the equipment you have, especially in the health sector, the attitude is poor, you're not going to really achieve a lot, There's a lot of psychology managing ill, and just your attitude and your perception goes a long way in providing some aid. We all have mission and vision statements, and really, how many of us who work here live and work with those ethos? And I think for me, that is something that we should take. The cleaner should understand, I'm in the hospital, I'm working as a cleaner because I want to be part of healthcare delivery. So if a patient, if I'm sweeping and somebody walks past, I shouldn't be angry that the person has dirtied, maybe they're coming from a muddy place. I should realize that this person is ill and has come for help, and I shouldn't, my attitude shouldn't be one that makes person feel bad. The same thing with the healthcare professionals. You understand that you're stretched, you're overworked, but how you receive patients and how you counsel them. Just funny enough, today I had to give a lecture this morning before I came here for doctors who are specializing in anesthesia, and I needed to talk on patient counseling and breaking bad news. So those are things about communication skills. It's not about how much skill I have as an anesthetist, but my non-technical skills. And I think that is something I think we need to change completely, like almost a 360 degree. And I think it will affect everything. It will affect our policies. It will affect how well we even use the resources we have maximally for effectiveness. So moving forward, I think it's something that one has to, like going back, I need to emphasize. But I think, everything starts from we.
Yes.
Yeah, the leaders, when they see your attitude,
Yes.
then they know they kind of, you also act like an example, really, and say, oh, if she does this and she talks this way, then it means I can.
Yes.
Yes. So
Lead by example.
Lead by example.
That's
I think
it.
that is what we need.
That's it.
All right, so you've talked about resources too. This is a time where there is limited resources, whether it's for government or if it's for private enterprises. So alongside strategic thinking, strategic insight, thinking, planning, comes the issue of budgeting. If we look at the health sector, now, how do we appropriate the funds, limited funds that is budgeted for healthcare service? In the course of the training today, primary healthcare facilities were mentioned. And we know that at this time, it's of priority to the Federal Ministry of Health to revitalize the primary healthcare system. But when we come to budgeting for them, equipping this primary healthcare system, does it look actually that there is a lot of thoughtful thinking and planning into how the primary healthcare system should work and meet the needs, deliver value to the consumers of healthcare?
Thank you. What I've realized is the primary healthcare needs minimal equipment. A ventilator would cost about 30 million naira. A primary healthcare center does not need that. They need the basic things to check patient's pulse, things to check patient's blood pressure. But what they need at that level is capacity development and training. To know, how can I identify someone who is critically ill and do a little bit essential care and move. So those things don't really cost so much. But the important thing is if you invest and ensure that they have the capacity, they have the training, they have that incentive, they're made to feel important, it improves the overall health indices of the country. So yes, a lot is budgeted in there. How well is it being utilized? And I think because I go to a lot of places, because I also do a lot of non-governmental work. I'm the president of the Medical Women Association of Nigeria in Edo State. So we do a lot of training and advocacy, and we go, to talk to, health care workers and all of that. And realize that they just need education, they need incentive. They also want to feel that they matter in the overall health, and they really matter because they're the ones closer to the people. The community, people in the community feel comfortable with them than coming to the hospital I work, because there's that personal relationship. Yeah. So I think investing in primary health care is good because it will improve the overall health indices. But capacity building is key in doing that, and I will hope that we will have that the insight and the zeal to do that and provide such in all the communities.
Okay, I'm going to take it from here now, the insight. How do we get the insight as to the exact need of the people? We're looking at the medical field now, or the medical sector, because that's your area. Now, it's one thing to say, let's focus on the primary healthcare sector, and that's a way to ensure that healthcare gets to those at the grassroots. But how can these things be linked? So someone goes to the primary healthcare, like you mentioned that the primary healthcare center doesn't need much equipment, but if the case becomes severe, because people go there for basic healthcare needs, maybe they're not feeling very well, for mild ailment, but where they're diagnosed with something more severe, then there's referral to a secondary healthcare system. You find that in some localities where you have primary healthcare centers, the nearest secondary healthcare facility is so far. So it's kind of hard for people to just move like from one level. So if it's very severe, then you easily move to the next healthcare facility that can attend to. Is that a missing link? Is that why sometimes certain policies that are supposed to yield results at the implementation stage seem not to be giving the right results? How can this be corrected?
Yes, it's those are part of the things. You have to realize that there are a lot of delays in accessing healthcare and reducing all these mortality indices. From your home to the hospital, that's another thing. From the hospital to the referral center. Now, ideally, everything comes, to get to even the primary healthcare center, the roads may be bad. So even if I know I should get there, I can't even access. But another thing, the very important thing is that these healthcare centers should have ambulances, means to move patients from the primary. It shouldn't be their responsibility anymore to say, I have to now think of how to move myself. And you can domesticate this. You see, these tricycles have been used in places like India as a means of moving persons from the primary healthcare to a secondary healthcare. And that responsibility is not borne by the patient, it's borne by government. I should be able to transfer a patient, even from my facility, to another facility that does more of the cardiac issues if I can't handle that, or in neurological if we have limitations. Now, who bears that responsibility? Should it be the patient or the government? It should be the government. Because the person has come to a government facility to seek care. And we all understand, you can't have all the facilities in one place. So you also have, like, we talked about the ratio of doctors, I realize that we are far from ideal, But the thing is, if you need to repair that bridge, the ambulance services, it is responsibility of government. You have trauma centers, but if I have a trauma on the road, is there an ambulance that will pick me and take me to the closest trauma center, or I have to wait for passerby and good Samaritans who will take me? And sometimes they even increase the mortality in moving critically ill patients. You understand? So it's I would say it's complex. Sometimes it seems daunting, but I think it is something that can be done. You see other societies and see, oh, these policies they've had, how did they? You understudy, and you should try and replicate, not in full. You domesticate it
Based on your
own
needs.
environmental factors, and all of that. But see how it works. I don't want to believe, oh, there's a problem that cannot be solved, because I think that's why we are humans and intelligent. Yeah.
Okay, so I'd like you to speak to this. There are some roadblocks that I call it roadblocks because oftentimes, if that's the right word now, you see people when they are in a state of emergency, bring them to the hospital, and you hear that there are some policies or rules that are in place saying, oh, we can't do this, oh, sorry, you have to provide this, and all of that. Again, health, they say, is wealth, right? So if someone is alive first, he or she could find a way to run around to sort out some other necessary things, So is it possible we move away from, if this is not available, we cannot treat? Those roadblocks. Is it possible?
Oh, sure. Now there used to be a lot of hesitancy. Oh, do you attend to gunshot victims until you get a police report? Recently they have said no. You attend to them while in the process of doing that. And I think it's wrong to tell people to pay before attending, because that is where that is what we call emergency. It is in the first 24 hours, and that is critical in survival. Because I could be walking across the street, I wouldn't take my ID card, I probably didn't take my phone. I get knocked down by a vehicle. I get to the hospital, I'm unknown.
Yes.
Because at that point, nobody knows who I am. But that doesn't mean I'm not even on a health insurance policy and all that. But it is important at that point in time to offer emergency and essential critical care. And that is something we're trying to advocate really, to ensure that is available for 24 hours. They're able to give oxygen the patient needs, and stabilize that person in the first 24 hours at least. Subsequently, you can now find ways, and I think a lot of hospitals are actually changing that narrative. However, where I work, I can only speak for where I work in the ISTH era. For the first 24 hours, sometimes extended, you get emergency care.
All right.
Emergency care.
I want to believe that is happening because it's a policy of the management that treatment should come first before other things while they're on the process. Okay, so this training that is for top level managers, I believe that all of you will go back to your respective organizations and begin to implement the changes via policy initiatives and all that. But we also find that in some organizations where policies have been made, the policies are not even understood by those who I may want to refer to as foot soldiers in questions, those who are on the ground to carry out the activities, the functions necessary for the full implementation of the policies. Some of them are not fully informed, they do not understand it, and sometimes there is no buy-in. And when there is no buy-in, you don't expect that people will do what is necessary to have this. So it doesn't really work. On paper, you have this policy, that policy. For instance, the issue of treatment or payment before treatment. That you say is happening in your organization. But if we go to some other medical establishments, particularly the private run ones, that may not really apply. So how do we ensure that top level managers communicate effectively policies, secure buy-in, and then they become things that the consumers enjoy? Even to what you were talking about when we talk about the primary healthcare, the ambulance situation that happens in other countries where the tricycles are used. In that training, I also listened, yeah, and I got a part of it.
Okay.
When the facilitator for today, talking about Dr. Ken Kenwa, who was talking about the client's functions or consumer functions. So what you need to actually deliver the service that your consumers are expecting to get from you. So what is the role of the manager in all of this? Communicating the policy and also ensuring that the client functions are available, even the technology. And so everything is well structured to meet that goal.
Well, the thing is really, you come here and you get all the stuff, you feel ginger and you're ready to go back to your school, like, I'm going to cause so much change. But it's very important to cascade it down, because of course, they have units and unit heads. And so it's important going back, you cascade it and ensure it goes down. But the important thing is also monitoring and evaluation. And performance indices, what do you expect? And come back and have a discussion in the next month or 3 months. Should I do an evaluation? Performance and see for patients who have had it, access that. Do I need to get feedback from the clients and after the feedback mechanism? Do I need to develop the institution's website and let clients know that they can go there and give us feedback on, when I came in, how long did I just spend the whole day before I saw a doctor in the clinic, or I came and I, because I had booked the appointment at some time and I didn't want to be kept waiting, and I did see, or I came by 7 a.m. and I didn't wait till 5. So we must monitor and evaluate, and I think that's really very important. We must get feedback from the clients, our patients who we render this service, and then I think getting feedback from them shows us where are the points we need to improve, because they are the consumers really. We may think we have like the idea, perfect idea to make this, but if we don't engage them, we won't really know exactly if they're actually making a positive impact and all the policies really are to their best interest, which is what we should do. But I think cascading this information down to everybody, even up to the cleaners, porters, it's really very important. And I do that because I do a lot of work in intensive care. So I will tell the cleaners, I say, you are very important here, because people who are here are very, very ill. Talk to them with empathy. Talk to the relatives with empathy. They are going through a lot. So and they make them realize that you're a cleaner in the intensive care unit is different from being a cleaner in an office.
Oh yes,
because
it's
when
true.
you interact with the patient relatives, sometimes they look at you and they want to get some comfort. So even when you smile at them, even if you're trying to tell them, oh please don't litter this space, or you tell them with some compassion and empathy. I know we're quite cultural here. Oh, don't worry, God will do all those kind of nuances. So it's different from you're working in an office. So your attitude is different. So it cascades on so that they feel that yes, they are part. And I think that is the attitude that needs to change. And I think in our smaller units, when it's as a manager, it's cascaded down. And once the smaller units grow, I think it improves, the overall system. It might take some time. There will be issues. You will have persons who do not feel they need to change their attitude. But reward system is also important.
Okay.
And incentives. And there should be some punishment for people who do not meet up. Because in the private sector, you have those things. That's why private sectors run so effectively, sometimes compared to the public sector. Even if you put in so much for them, realize that if you do not meet up, this is how it is. But if you do well, you have incentives, to encourage people who are doing well. And we must always be optimistic.
All right. Okay, so I love that we must always be optimistic. So I want to bring you back to the training. So you spent a couple of hours learning, unlearning, you've unlearned,
Yes.
and relearning at the same time. So would you say you've been able to pick out some key, skills or messages that you'll be taking back home. Talking about probably you identify a major challenge in your sector and you feel this training has actually availed you the, what's it called now, a way out, solution to solve those challenges.
Yes, and there are two things, maybe not just in one place. I think I've learned the fact that, maximizing your strength and then you need to be proactive and creativity. The idea that you don't necessarily need to like someone if somebody has those strengths. Maximize the person's strengths. Usually we feel, I really don't like you, so I don't really want you to work in this office, even if the person has the capacity. But now I realize, why don't you maximize that person's capacity, to deliver whatever thing you need effectively? Then I think the key is collaboration. Because some of us in public institutions, we all want to, this office is the best. We're the best, we're better than this other one. But really, we can collaborate and be much bigger than what we want to. So for me, I think that's idea of collaboration is key. Attitudinal change is really key, and letting everybody's decision be linked to the vision and the mission of the institution. I think that's aspect, because when you did ask me about that, I was like, do you think even how many people know the vision and mission of your institution, and does the cleaner know that? Because if they're linked to it, it changes a lot.
Well, you just took the question out of my mouth when you talked about collaboration, because in there it was quite an issue when the facilitator for today's session talked about moving away from competition to collaboration. Yes, you can have competition in the private sector, but when it comes to the public sector, it's more about collaboration. And I think that's what's missing. That's why it seems like everybody is fighting one person. Some agency wants to be the hero, and while others feel like, well, what can we do? So there's like a superiority fight and all that. Well, thank you so much, Dr. Mrs. Irene Hideno, who has been with us here on Souq Podcast. She's a participant at the ongoing ADSC, that is African Development Studies Center, and the National Institute for Public Strategic Studies here in Lagos. So she's not the only one. We promised you, and we're actually delivering on what we promised you, that will bring to you some of the participants as well as the resource persons. The show continues, or rather, the training continues, meaning Souq Podcast will continue tomorrow. We're bringing to you the facilitator and all the participants. So you need to stay tuned so you can be up to date as it concerns happenings here at the ongoing ADSC NIPS training. I am Blessing Aichi. I've been doing this today with Grace Komalafe.
Thank you very much, Blessing. Like I said, it's a pleasure doing this with you, and I hope I'll be here again tomorrow.
Oh yes, of course.
Yes, we'll do this together tomorrow again. All right, till tomorrow, we'll see you.